I think the big thing is Don has just been a tremendous mentor. To anyone who's reached out to him, he will go above and beyond.
It's an interesting mixture of sort of dogged determination and then the flexibility for change on the other hand.
You know, some people see Don as really a strong figure that wanted to control stuff. He does like to control things, no doubt. He likes his control, he's the Don. But he also is incredibly generous in getting the best for his program, for his patients, for his city.
As a youngster, I spent a lot of time with my great Italian grandmother, and unfortunately, she developed heart disease. So I think that was a driver going into medicine. I just wanted to go into a field that helped people. My love and drive towards cardiology was really related to the physiology, the heart system, the circulatory system was very exciting. That became my passion. I was lucky enough to be accepted to Stanford University, where I did my first 3 years of training. I think that was the major learning experience for me, to adopt a culture, to always be alert to a different way of doing something, a better way of doing something, and nearly always there is. My career really at VGH from the time I arrived in '78 through to my retirement was in the cath lab. The breakthrough in terms of developing the cath lab really was with the advent of angioplasty, where there was suddenly a therapy that you could undertake. That allowed us to move the cath lab into a really academic sphere.
They were leaders in angioplasty, leaders in putting in stents, and led really the groundwork for a lot of the non-invasive cardiology that's gone on in Vancouver.
He built a cath lab that had that ethos of looking for excellence. We had a way of facilitating that, loving the problem, let's come up with a solution, iterative approach. Our problem was that we had these people that had heart problems. We did angioplasties, we'd open up the artery would collapse back down, and back. And there were some solutions to that in stent technology.
The stents of the day, particularly the Pomaz-Schatz stent, was designed as a first iteration stent to keep the artery open and in a particular place. We were trying to do cases that were beyond the capability of that current stent to do. It was not flexible enough, it was too hard to expand, so we ran into some challenges. But at the end of the day, I went home with Dr. Penn and had dinner with him. We sat there eating soup and bread and drinking wine and talking about the problems with the Pomaz-Schatz stent and what might be done to improve its performance.
They hit upon the idea of carving out a stent out of a little tube of a special kind of metal that when it was exposed to a balloon, it would swell up and fill the blood vessel.
We needed to find somebody who could make the device for us. We got the name of a laser physicist in California. His name is George Shukoff. He'd send us back some stents that were cut on his laser, and Ian and I would fiddle with them and test them and see if they solved the problems that I'd mentioned. And finally, we were at a point where we had a design that we froze because we thought it did what it was supposed to do.
And that basic shape is used even now in almost all stents that are carved out of tubes. So it was pretty impressive.
He, working with Ian Penn and others, figured out a way to make stents actually work inside humans, which now this is hundreds of millions of people have been treated this way, so amazing.
That formal healthcare system desperately needs innovation and, frankly, capital to drive forward change in order to be sustainable and keep up with the times. So what we're endeavoring to do with the Innovators Challenge is to build a bridge between the private realm of commercial activity and the public healthcare system. And I think Don offers a very elegant example of how to do that.
I'm delighted to have paved the way and would hope that others are inspired by the kinds of culture and mentality I've described, a mental attitude about always thinking about ways to improve what it is you do. I'm happy that this award might do that.